Health is an integral component of national development. With every passing day, Kenya's population has to be cautioned from the rising effects of such infections like malaria, tuberculosis and HIV/AIDS. For example, according to the 2007 AIDS Indicator Survey, an estimated 1.4 million adults in Kenya are infected with the HIV virus that causes AIDS. HIV touches the very core of nearly each and every family in the country. Since some of the causes of HIV infection are closely related to reproductive health, the integration of both is deemed crucial in the provision of health services.
It is important in the sense that the clientele, the people who seek these services are the same. There are a lot of commonalities between these. In essence, HIV is an Rh component because it's sexually transmitted. It's one of the sexually transmitted infections, along with gonorrhea and chlamydia and the syphilis and all. HIV had taken the center stage because it has gone across the social fabric of the country. That's why it became a verticalized program to deal with it for a time, but it is within RH.
For millions of women and youth, reproductive health RH services are the primary entry point into the health system. Integrating HIV into RH settings, therefore, increases their access to a range of HIV information and services in a more conducive atmosphere as opposed to standalone HIV services.
Talk to our people, our communities, our healthcare givers that reproductive health is about everybody. You cannot just limit it to people who are not infected. I think those who are infected requires it more, and because they require extra care before they get pregnant, during the pregnancy, and after the pregnancy. Because if anything goes wrong, then they are likely to deteriorate in their health, and if they deteriorate in their health, then you'll be losing that mother. Or if they do not take care of themselves, they are likely to give birth to a child who is infected, and that means then there'll be two people who are carrying the virus, and that becomes very costly in terms of the family and in terms of the nation.
In implementing RH and HIV integration, the government, through the Ministries of Health, works closely with development and implementing partners. The Kenya AIDS NGOs Consortium, KANCO, is one such partner.
The RH-HIV integration is a project that is supported by the Population Action International, and the project, the Integration Partnership Project. The main objective of this particular project is to lobby for prioritization of RH-HIV integration in the PEPFAR strategies, increased resource allocation within this sector, mainly through Global Fund, and also sensitization of the communities on RH-HIV integration.
KANCO's Drop-In Center, or RAY project, located at Ongata Rongai in the outskirts of Nairobi, targets the most at-risk populations MAPs, who include commercial sex workers, using the peer-led approach, community mobilization, and facility-based approach. They benefit from a wide range of integrated services at the center, which serves as a one-stop shop in the provision of health services at no cost.
This place is called Drop-In Service Center. We basically deal with the sex workers, and the center began in March 2009. and with time we have continued to have many other services. We just began with one service as a VCT site, but we've been able to offer many other services at the drop-in. We've also been able to register sex workers. We have registered 1,670 sex workers as per today, and we offer integrated services. We are one of the centers that can talk about integration because we've been able to offer integrated services. When the sex workers come, they're able to get STI screening and treatment, TB screening and treatment, OIA's management, that is opportunistic infections management. They're also able to go through counseling. We also have other services that we offer the sex workers. We take them through organizational capacity development and entrepreneurship training for them that will be interested.
Helen Achieng is a regular visitor at the center, where she attends the comprehensive HIV care clinic monthly and the weekly support group activities. Today, she has been unwell and dropped in for treatment and advice. Helen, a mother of 2 girls, has been HIV positive for the last 12 years. Her 1-year-old second-born daughter is HIV negative, thanks to the Prevention of Mother-to-Child Transmission PMTCT services offered at the center.
Tulifundishwa ya kwamba mwili yangu iko na mahitaji yake, siwezi kataa kuwa na mwanaume. Tulipatana na mzee alikuwa positive, tunaishi discordant couples, lakini kulingana na ile mafundisho tumefundishwa hapo drop-in, hatujawahi kosana na yeye. Hata wakati nilikuwa napata mtoto na tuko naye mpaka saa hii.
Rongai, the neighborhood that houses KANCO's drop-in center, is probably one of the fastest growing urban centers in the country. Like most such centers, affluence and squalor exist side by side. Kware, where Helen lives, is an informal settlement with all the attendant problems like poor infrastructure, inadequate water supply and sanitation, not to mention the absence of electricity. To earn a living, many an area resident engage in all manner of illicit activities. But for Helen and her colleagues who access services at the drop-in center, the treatment, training and the life skills gained have changed their lives.
Drop-in nimepata masomo mingi sana. Nimefundishwa mimi ni community health worker. Nimefundishwa kutengeneza sanitary pads, hiyo nakulia. Hii sabuni yenye nilikuwa nabeba hizi vibuyu na zitengeneza hii detergent na ninauza. Mpaka saa hii kuna kikundi niliingia last year, ambapo ndio walinipatia pesa. Hiyo loan niko nayo na nikaona ile kazi naweza fanya na nikatafuta hiyo wines na kuambia KANCO imenitoa mbali.
The implementation of RH-HIV integration is not devoid of such logistical hitches like insufficient funding. But that notwithstanding, the project gains far outweigh the challenges. In view of the importance of RH-HIV integration in health service delivery, KANCO and other implementing agencies will continue to expand the uptake of these services, whose success the government remains cognizant of.
Integration of RH and HIV is a plus for the country in terms of savings of economy of scale, in terms of client services. The same client who comes for FP is the same client who needs HIV services in terms of counseling and testing, in terms of prevention of maternal and child health, in terms of ARVs access and cervical cancer screening. And we're not only integrating HIV and RH, we're integrating maternal child health services, integrating cervical cancer screening, integrating HIV/AIDS, integrating TB, and soon malaria. So that you go to one facility, you get a full package, one stop shop.